Spondylosis basically it's a spinal osteoarthritis and it is a degenerative disorder. Basically wear and tears that occur in the joints and bones of the spine as people get older. Who affected by this disease? More than 85% of the people over age 60 are affected commonly. Next thing is where spondylosis occur in spine. It mostly occur in cervical, neck region, thoracic, mid-back, lower back, low back area. Damage itself causes basically the loss of normal spine shape and function. Reason for getting spondylosis: number one is aging. When we get older, the disc dehydrates and become thinner and become harder. Then they provide less support to the vertebra resting on the disc. Next reason is repetitive strain injury caused due to lifestyle without ergonomic care. For example, by working in front of computer, driving, traveling, intense work in farm, etc. More reasons are: number one, genetics, occupation, job with lots of neck motion and overhead work, mental health issue like depression, anxiety, and traumas and injuries. So the main question is how it develops and its physiologies. Basically, cervical spondylosis is the degeneration of the intervertebral disc. With age, the disc fragment, lose water content and collapse. Number one, it starts in the nucleus pulposus, the inner part of the intervertebral disc. The water content will decrease and will bulking inward. The annulus fibrosus, which is the outer part of the intervertebral disc, will become thinner and bulge outward. When the intervertebral disc becomes thinner, it will increase the mechanical stress at the cartilaginous end plates at the vertebral body lip. Then the cartilage that covers and protects the joints wear away and cartilage wear away completely, resulting in bone rubbing on bone. Over the time, the bone overgrowth, which is called spurs, may narrow the space for the nerves to pass through the stenosis, causing some cases enroach on nerve tissue. Then we move on to the symptoms. Number one, pain. Number two, stiffness, feeling of numbness and weakness in hands and legs, trouble walking, loss of balance, muscle spasm, continuous headache, grinding and popping sounds in the neck region. Then we move on to the diagnosis criteria for spondylosis. Two basic criteria. Number one, X-ray. The X-ray shows aging changes, disc height loss and bone spurs. MRI shows study of nerve, tissues, muscles. So, the most important thing, how to cure spondylosis. We have different treatment options. Number one, we can use soft collars for neck or lumbar corset belt for the lower back area. Then we can change our environmental changes, proper lifting technique, avoid prolonged sitting and standing, ergonomic modification for those who are working for long period of time, and the best option is physiotherapy. Other medications we can use acetaminophen, NSAIDs, muscle relaxants. The main purpose for why we are going for the physiotherapy and we are calling the physiotherapy is the best option, because physiotherapy, number one, relieves the pain, restoration the movement, strengthen the muscles, education of posture, analysis of precipitating factors to reduce reoccurrence. There are many physiotherapy treatment options. Number one, we can apply cold and heat therapy to the affected area, deep tissue massage to release the tension in the muscles and the tissues, mobilization of spine to maintain the mobility of the spine, to regain the movement of the spine, electrical stimulation like TENS to relieve the pain, and we go for posture correction exercises. Important thing, we maintain the core muscle stability exercises. In the last, I have a special tip for daily life for healthy spine. Number one, de-stress your spine while sleeping. Number two, exercise your core. Number three, wear shoes that support your spine. Number four, support your spine while sleeping. And last thing is indulge in massage.